Thank you very much for this great opportunity. I thank my team in Ghana, the Cleft team in Ghana. I want to express my great appreciation to the team headed by Professor Peter Donko and all the other staff there for your support and your encouragement for helping me to achieve this great feat. I also thank Smile Train Africa and Smile Train International for this opportunity to share my experience and my knowledge to help improve cleft care in Africa and in the world as a whole. This morning, we'll be dealing with the subject social care for persons with cleft lip and palate or orofacial cleft. Okay. Yes, so as I mentioned earlier on, this morning or this afternoon or evening, wherever you find yourself, we are looking at social care for persons with orofacial clefts. And this will be the outline for this lecture series. We will have first our introduction. We will define what is social care. We will look at some principles of social care. Then we would move on to activities in social care. Who is involved in social care? Then we would bring our lecture to a conclusion. So let's kickstart. The management of orofacial cleft entails dealing with social issues or factors that affect the patients to improve health and well-being. This involves services that protect the patients or satisfy their needs. We are aware that persons with orofacial clefts do not just have the deformity. There are other social issues which also affect them. Some of them come from very poor backgrounds. Some of them are in abusive environments. Some have been abandoned by their relatives. Some also have other deformities or other medical issues in addition to the cleft. So because of all of these factors or issues which affect the patients, we must ensure that the services that we provide will help to protect these patients from whatever situation that they are in, which is not good for their health and well-being, and also would help to satisfy their physical needs, their social needs, their emotional needs, and whatever needs that we will identify as they are having. Therefore, orofacial cleft teams must consider ways of dealing with the different levels and types of care provided to patients by ensuring that they are able to deal comprehensively with the needs of the patient. And so at each level of care, whatever type of care or service that we provide for the patient, we must ensure that those services, those care that we are giving to our patients, we are able to help them deal with whatever issues that they have. And so during the pre-surgical stage, whatever issues that we will identify that the patient needs, we must ensure that we are able to provide care or service which will be able to deal with those issues. After surgery or post-surgical, whatever issues that the patients would have, we must ensure that through the provision of social care, we are able to deal with all those issues to ensure that quality healthcare is assured. Now we move on to the next subject, which is the definition of social care. Social care has been defined by the Cambridge Dictionary as care provided by public organizations and private companies for people in society who need special help in order to live comfortably. For example, help with washing or eating. So social care is not only just provided for persons with clefts or Orafacial cleft, but there are other people in our society who also need social care. For instance, the aged and other persons are also people who need social care. And there are institutions, both public and private, who provide social care for people in the society who are in need of such care. Now, when it comes to the professional setting, social care is the provision of social work, personal care, protection, or social support services to children or adults in need or at risk, or adults with needs arising from illness, disability, old age, or poverty. I believe that we will all agree that persons with clefts are in need and also they are at risk. And therefore, because of the need that they have and because of the risk that they are in, we need to protect them. We need to provide them with services which will ensure that the challenges that they are facing, we are able to help them deal with them. And so social care is focused on providing assistance with activities of daily living, maintaining independence, social interaction, enabling the individual to play a fuller part in society, protecting them in vulnerable situations, helping them to manage complex relationships, and in some cases, accessing a care home or other supported accommodation. And at Konfanochi Teaching Hospital, some of the things that we have done to ensure these things that I've mentioned is that we instituted the home visit program. And through that, we got to know that there are some of our patients who in their communities have been abandoned. And through interactions with their community by organizing education programs for their community, we help to ensure that these persons have been reintegrated in their communities and they were able to have the chance to interact with their community members. I remember a story of a boy whom we rescued from a community about 8 years ago. As at that time, this boy was 8 years old and he had not been to school because when he goes to school, he was mocked at because he had an unrepaired cleft lip. We brought this boy to our center at Konfanochi Teaching Hospital and the lip was repaired. And when we sent this boy back to society, everybody in the village trooped to our car to see the change which had occurred in this boy's life. And because of the repaired lip, this boy was able to go back to school. And through that, the community got to know that this is something which can be dealt with. And it wasn't a curse as they used to believe. And so through some of our activities that we are doing in providing social care at Cleft, we've been able to help protect our patients from vulnerable situations. We've been able to help them to play a greater part in their society. Now let's look at some of the principles of social care. Some of the principles of social care. Social care must be person-centered. Now, when we say social care must be person-centered, what we are saying is that social care must be centered on the needs and concerns of the patient and not on the needs or concerns of the caregiver. And so when we are providing social care, we must look at what are the needs of the patient so that we can be able to tailor our services to help address the concerns and needs of the patient. And that is what is meant by person-centered. Social care must also ensure individuality. Sometimes we are tempted to treat our patients the same, but we should know that our patients are differently. Yes, they may have similar issues, they may have similar concerns, but how we go about providing support or providing relief for those concerns must be different. So the way and the manner how we helped or provided support for person A must be different for person B, though they may have similar issues because of their individual differences. They are coming from different backgrounds. And so we must take into consideration the individual patient when we are providing care. Social care must also emphasize choice. We must give our patients the opportunity to make decisions for themselves. We must not always decide what is good for them. We must also give them the opportunity to choose or make choices where possible. When the patient has the capacity to make informed decisions, then we should allow them to make those decisions. Also, we must ensure privacy when we are providing social care. Sometimes our patients will be shy or they will be embarrassed to give us information about themselves. When we realize that we need not to push them, let's give them the chance to have their privacy. And I believe that as time goes on and the relationship between us and them gets deeper, as we build rapport with them, they'll be able to be comfortable to disclose to us whatever information that we require to provide help for them. Also, we must respect our patients when we are providing them with social care. Just because the person has cleft doesn't mean that we can treat them anyhow. We must recognize that they are human beings, they are persons. And so when we are dealing with them or when we are providing them with care, we must treat them with respect. We will treat them as we will treat ourselves or as we will treat persons whom are closer to us or whom we know. And so we must provide respect for our patients. Now, we must also respect the rights of our patients. When we are providing them with social care, they have rights as individuals. And so when giving them care, we must ensure that our care or our service do not infringe on their rights. Sometimes by providing them care, we will also get to know that their rights are being abused by their parents or by their family members or by their community. And we must ensure that their rights are protected from other persons who are abusing or infringing upon their rights. And we must also ensure that by provision of social care, we can make our patients independent. There are some of our patients who will have to depend upon us to feed themselves, or for parents who are unemployed to be able to feed their children. Through our social care, we must be able to ensure that these persons have become independent so that they will be able to take care of themselves. We must also ensure that we treat our patients in dignified manner. And so the nature of care that we provide for them, when they come to us, when they are waiting for us, what is the environment that they wait before they are seen? Are they allowed to sit in the sun? Are they allowed to sit in places where they will be at the mercy of the weather? I don't think that we ourselves would like to be in situations where our dignity is not ensured. And so we must also ensure that in providing social care, we ensure the dignity of our patients. Social care is about partnership. The patient and the caregivers or the Cleft team or the Orafacial Cleft team, we are partners. Most often when there are issues that I am called upon to intervene, especially where parents are refusing to give consent for treatment for their kids, what I tell them is that parents and medical team or health caregivers, we are partners. We all have roles or responsibilities that we play to ensure the overall health and well-being of the patient. And so the caregivers and the family or the patient, we are partners, and we must ensure that whatever that we are doing, they have a role to play. And when they have a role to play, they will know that they also have a responsibility that they need to do to ensure that the service that we are providing, the ultimate goal, is achieved. Now, we must also ensure confidentiality. When we are providing care for our patients, we must ensure that whatever information that they give to us is kept confidential. The information that they give to us should not be the subject of our conversations. When we are having lunch, it is not there that we are going to discuss the information that our patients have given to us. If we need to use that information for educational purposes or for publicity, we need to seek their consent. We should not think that because they are vulnerable, we can do whatever that we want with the information that they have given to us. And so we must ensure confidentiality. Social care is anti-discriminatory. We must not discriminate against our patient on the basis of their age, their sex, their tribe, their language, their religion. We must ensure that our care is anti-discriminatory. We should not say that because patient A is from tribe A, and because I am from tribe B, I'm not going to provide whatever help or support that the patient needs because he's from a different tribe from me, or because the person is poor. I'm not going to provide the help or the support or the service that the patient needs. And so social care must not be discriminatory. Also, we must uphold culture and personal beliefs. The care that we provide for our patients, we must be culturally sensitive. But there's a caveat to it. There are also some cultures which are inimical to the health and the well-being of the patient. And so we must know which cultures that we are to uphold and which cultures that we must fight against, because sometimes some of the cultural and personal beliefs are also abuses against the patient that we must protect the patient from. For instance, there are some cultures which frown upon persons born with disability, including persons born with Orafacial cleft. And in some of these cultures, such persons born with Orafacial clefts sometimes are killed. And so if a person from such a culture comes to you with a child or if a person with Orafacial cleft and tells you, I cannot take my child or my relative back to my community because it is a taboo for us to have a child with cleft, and so you must kill. I don't think we should uphold that culture. That culture is against the rights of the person. And so for cultures or personal beliefs which are not in the best interest of our patient, those ones, we cannot uphold them or we cannot respect them. But for cultures which are in the interest of the patient, which when we uphold would help the patient to know that we respect them, then for such cultures, we can respect or we must uphold. Then lastly, social care must ensure protection from abuse. As I mentioned earlier, Some of our patients are in abusive situations. Some have been abandoned by their family members or their community. There are some whose parents are not taking care of them because they have orofacial clefts. And so we must ensure that these abuses that our patients are suffering, we are able to protect them from such abuses by the provision of the appropriate social care. Now let's look at some activities in social care. Firstly is we need to gather information. We cannot be able to provide the appropriate social care without information. And so it's important that when we get into contact with our patients, we are able to gather the right information about them, information about their background, their family, their occupation, the community where they are coming from. Are they getting the right support from their community? Are they in any form of abuse? All of this information will help us to be able to know their needs and to be able to provide the appropriate care for them. Now, when we have been able to gather the information, then you have to assess the needs. Patients will give you a chunk of information, but it is now dependent upon us as Cleft team or as caregivers to know which of the things that they have spoken to us about should be ranked first. So in assessing their needs, we need to make priority. Which needs should come first, and second, and third, and so forth. And so when you're able to assess their needs, then the next step is now we are able to design the appropriate care plans. Okay, so we know that patient A has financial challenges, and because of the financial challenges, he will not be able to come to the clinic or to the hospital for care. He will not be able to buy or afford medications or labs and other things. And so when we have been able to assess the needs, then we are able to design the appropriate care plans which will meet the needs that we have assessed and identified. When we have designed our care plans, sometimes it is appropriate that we consult with other service providers because it is not all of the needs that as Cleft teams or official Cleft teams we can be able to provide for them ourselves. There are service providers both within our facilities and out of our facilities that we need to liaise with or consult so that they can also help in providing services for our patients. So sometimes we may need to consult with the social welfare departments in our communities. We may also need to liaise with the local government authorities. There are instances where we will have to call upon the police where there are issues of abuse. There are instances where we will need to liaise with care homes so that they will provide accommodation for patients who don't have accommodation. And so we need to have a knowledge of some of these service providers so that we can consult them to provide the needed help or service for our patient. Also, we also need to provide links to resources so that our patients can go to some of these resource centers for help. And so we can provide them with letters or recommendations so that they can go to some of these places I have mentioned so that they can get the support or the need that they want. And another activity is that we need to help our patients to manage change. For instance, a couple who has had their first child being a child with orofacial cleft. Indeed, this will be a very big and huge change for them. And as part of the management of social care, we must help them to manage this change. They were unprepared for it. And in our Africa setting, where most often we are not able to diagnose clefts before the child is born, we must help them to be able to manage the change. They'll be going through a lot of emotional trauma, psychological trauma, and all these are part of the social care that we need to take into consideration. Also, we need to monitor the progress of the patient to know whether the service that we are providing is making the right improvement or not. And so when we first saw patient A, the patient was underweight. The patient was not able to afford medications because the parents didn't have employment. The patient was not able to come to the hospital regularly due to financial challenges. When we have provided the needed support, what has been the progress that has been made by the patient? Is the patient now able to come to the hospital regularly? Is the patient able to afford medications? Has the patient's weight improved? And so all of the expectations that we were expecting the patient to make by providing the needed social support, we must monitor whether we are making good progress or not. Then finally, we need to make a budget for our social care activities. It comes with a cost. And so when we are planning on activities for social care, we need to prepare budgets. And by preparing budget, it makes us proactive because we don't have to wait for our patients to come with the problems before we begin to make arrangements. But when we have made arrangements, we have prepared our budget for the activities that we will need in terms of social care, then it becomes easier. Also, it will also help us to even secure support, especially from Smile Train and other organizations, that these are the activities that we want to embark upon in terms of social care for our patients. And we believe that your support would help us in going a long way to provide the needed help so that our patients can get the quality care that they are seeking. Now, the next subject is who is involved in social care. Who is involved in social care? Definitely, social workers will be at the forefront when it comes to social care. The social care will be the social care manager in the team who will ensure that all the social care activities are done appropriately. Also, the relatives of the patient are also involved, especially when it comes to the provision of the activities of daily living. For instance, eating, bathing, and so forth. The relatives are very much concerned. It will be the relatives or the parents who will have to bring the child with Orafacial cleft to the facility. Whatever instructions that we will give concerning social care activities towards the child, it will be the parents, the siblings, or the grandparents, or friends who would help to ensure that these instructions are followed to the letter. And so the relatives are also important. And as I mentioned earlier, the parents or the family are partners with us in terms of the providing of care. And so they are very much important and involved when it comes to providing social care. Nurses are very key members of our cleft care teams. Very often, they are the first point of contact for the patient when they come to the cleft care teams. They are the ones who will gather the initial information about the patient before that information is given to other members of the Cleft team. And so nurses are very much involved when it comes to social care. Some of the patients tend to have very good and warm relationship with the nurses than other members of the Cleft team. And because of that, they tend to share a lot of information which they will not share with other team members to the nurses. And because of the position that nurses hold in the Cleft care team, by being mostly the first point of call when the patients come to our Cleft centers, they are very much involved. Nutritionists are also key players when it comes to social care. They will have to teach the parents of the child with Orafacial cleft how to feed. They will have to teach the right combination of meals, which will help in the improvement of the child's weight. They will monitor whether the parents are providing the right nutrition and whether the child is gaining weight or not. And they are also very much important. And where there is an occupational therapist on the team, they are also involved so that they can be able to help deal with the effects of the cleft deformity, which is having effects on the social, the psychological, and the environmental needs of the person or the child with cleft. Indeed, every member of the cleft team is involved in social care, but these persons are the principal actors when it comes to social care. So, as we conclude, what we are saying is that the complex medical care necessary for appropriate care of patients with Orafacial clefts can be time-intensive and overwhelming for many families. For many patients with clefts, they have to spend many days coming to the hospital, sometimes several years coming to the hospital. And this is time intensive. It is also financially intensive, especially where they will have to travel several kilometers away from their homes to the hospital. And so it is important that we take the appropriate measures to ensure that they are not overwhelmed, or we are able to lessen their burdens by providing them with the appropriate social care. And so we must be able to understand the needs of our patients, and so that we can be able to anticipate. And so in providing social care, we must be proactive. We must know that our patients are likely to come with some of these needs so that we can make the appropriate solutions available for them. And so even before they come with these challenges, or even before their needs are identified, we already know what to do for them. And that is what we call proactive social care. And as we are able to anticipate their needs, we are able to provide more efficient services for the patients and the families at all stages of care that will ensure quality healthcare for them, that will improve their overall health and well-being. Thank you very much. I bring my presentation to an end.
A very, very big thank you to Seth, Gyamfi. What a brilliant presentation that has brought us to the, that has really expanded our knowledge on social care. It has to be proactive. Our patients have needs, and these needs have to be met. And we have to be careful the way we deal with them, because they are individuals. They have their choices, and we have to treat them, their information about them as private as possible. Well, we are still waiting for your questions and reactions. I can see there is already a question for you. This is from Barbara Delage. He said, thank you for this presentation. That reminds us also that before all, patients with cleft are human beings and they are not defined by, well, what is this? They are not defined by their clefts. Well, I don't think there is a question there. There is another one. He says, this is from Ifo Loa Eke Tadi. So in regions where a cleft social care worker is not well established, or cleft social care is not well established, how best does one take up the task of setting up such? How best does one take up the task of setting such? 2, can social care also be outline based, be online based? So if I just take the question again, it said in regions where cleft social care is not well established, how does one take up the challenge?
Hello?
Hello, it seems like we lost our moderator. Let me read the question to you. In regions where a cleft social care is not well established, how best does one take up the task of setting up such? This is the first question. Would you like to answer this before I pull out the second one?
Okay, let me answer
Or
this.
do you need me
before
to read again?
Oh, I'm okay. I can even see the questions on the
Okay.
Q&A platform. Yeah, so as I mentioned earlier on, I indicated some persons who are involved in social care. And in dealing with clefts, we also deal with their social issues. And so if there is no social worker aboard the cleft team, then the other specialists, whether nurses, nutritionists, the doctors, can take the responsibility. So some of them could be made to provide some of these social care. The nurses, the nutritionists, and even some of the doctors can be made to provide the responsibility of providing social care. Or in situations, for instance, in Ghana, we have the social welfare department. And so where we don't have a social worker to coordinate social care activities, we could liaise with the social welfare department within our community so that they can help us in dealing with the social issues that confront our patients.
Hello, Seth. I due to some internet issues, I got cut off, but I think you are just answering the 2 questions that were posed to you. And if I'm back, then I will just ask the next question. This is from Fariyaro. This is from Dr. Fariyaro. He said, thank you for the presentation. He has some questions. He said, number 1, what is the status and outlook of social services to patients with orofacial cleft in African countries? He asks again, question number 1, what is the status and outlook of social services to patients with orofacial cleft in African countries? The second question is this, where these services are available, how have they been able to improve the care of these patients? So I want to repeat the questions again. Do you get the questions, Seth?
Yes, I do, Sammy.
Okay,
Thank you very much.
Answer them?
Yeah, my response to the first one is that Now, there is an appreciation of the work of social workers in medical care in Africa. Because 10 years ago, when I started work in Confanoche, there wasn't much appreciation for the services of social workers. But as time grew on, I've realized that now social workers are being given the opportunity to be part of care, and not just only in Cleft, but in other services. And indeed, I believe in Confanoche, Cleft, the activities or service of social workers was the highlight for social workers in Confanoche, because when we were able to provide quality care for persons with clefts, other clinical units also saw that then if we've been able to help persons with clefts, then we can also be of benefit to their patients as well. And so I believe that the status and outlook for social services for patients with orofacial cleft is going on, it is improving, and I believe that a time is coming where social workers will be an indispensable part, not just in the care of persons with cleft, but in other conditions as well. The next part of the question is, how have social services improved the care of patients? And I will use my facility, Confanoche, as an example. When I first joined Confanoche Teaching Hospital, we started what is called the home visit program. Now, through the home visit program, we got to know the challenges that these patients were facing, because some of them were coming from very far places. Some of them were facing abuse. Now, through the home visit, we were able to educate the communities. And now the communities began to appreciate that persons with clefts are not persons who are witches or wizards. They are just like anybody at all, and anybody at all could have been born with clefts. But we were lucky that at that stage of our development, our tissues formed, and therefore we were born without clefts. And through our home visits, we're able to educate communities, we're able to educate families so that they were able to accept persons with cleft. And the era where people were hiding their children, they were killing them, that has reduced drastically in Ghana, and that has also helped. And through the provision of social services, we have been able to improve the confidence of our patients. In Ghana, every year, through the support of the Ghana Cleft Foundation, we organize parties in December for our patients. And these patients come from all over the country to enjoy themselves. And for some of them, that is the only opportunity that they get to associate with a lot of people. And through that, we are able to improve their confidence. We are able to help them to know that they can also play a role in their society, and they can also do well. And so social services have indeed helped our patients in terms of their confidence, in terms of their high esteem, and in terms of accepting their children that they are human beings and they can also live full and productive lives.
Thank you very much, Seth. In fact, your presentation is generating a lot of comments and a lot of questions. I'm sure people are very interested and they really want to learn and know more. There is Professor Gikwa, if I get the name correctly, who says, thank you, sir. What do you think is the value of home visits to the families of children with orofacial cleft, since you pioneered this project of home visit in Kumasi? I know you know her very well. And
yes, I know her. Yes, she's my boss and mentor, and I thank her very much.
Exactly. And she's asking again, were these visits, were they helpful? Did the families like them? Or did something that resent the fact that you were coming to their houses? I think that's a very important question. It's an inside question Do you have an answer to that question?
Yes, please. Yes, our home visits, in fact, did a lot of good for our patients and for us as Cleft team, because one, it's made our patients to know that indeed we value them. For us to travel all the way from our center in Kumasi to their village, it showed the kind of importance that we attach to them. And it also made the communities that they were coming from to know that if these persons who live with us, we are not taking good care of them, we are abusing them. And these strangers have come all the way from the city to visit them, then we are not doing well. And so we must support them in whatever need that they have. It also helps us to know the challenges that our patients are facing so that we can appropriately address them. And so the home visit did a lot of good. And it also helped to improve our patient attendance, because we realized that through the home visit, we started getting increase in the number of patients that we are seeing. Because when we were going with a small train donated van, which had pictures of persons with cleft before and after surgery. And so people got to know that, oh, this condition is treatable. And so as we're going around, people started referring patients to us. They started calling us that I have a patient here, can I bring? And so the home visit also did a lot of good. People now got to know that, oh, Cleft services is available in Ghana. There's a home team which is available, and therefore we don't have to wait for foreign machines to come. There's a team available in Ghana who is available always to provide us with care. So home visit team did a lot of good for Cleft in Konfanoche.
Thank you, Seth. In fact, you see, when you were talking, I was nodding my head because I just stole something from you. And I'm going to improve our Cleft care here with our van. We'll be able to execute this home visit. It's very important. Every time we go out with these vans to pick our patients, it always generates a lot of eye raising. People are asking. I want to thank you so much, Seth. That is such a big thing I'm taking home with me. There is Dr. Mwabweze from Nigeria, I hope. If I get it correctly, she says you have a very good presentation. And Peter says, thanks for a wonderful talk. How can parents be organized to assist with the provision of social support? How can parents be organized with the provision of social support?
Yes, so let me use the example that we did at our center at Konfanoche. So we had a database of the parents who were coming, their contact numbers, where they were coming from. And so what we started doing was that we started calling them that we need you to have a meeting with you, because when you come to the clinic on the clinic days, we're not able to have a very good interaction with you because you are many and we have very limited time to see you. And so what we started doing was that every quarter we will call them for a meeting at their convenience, where we will have nutritionists, social workers, doctors coming to talk with them. And we also moved on by calling external professionals, let's say persons who are financial experts, because we realize that some of our parents don't have jobs to do. And so we invited some of these persons to also come and provide some financial training for them. And as we were doing that, you know, it solidified, you know, that relationship and that support, and it brought them together to a point that, you know, the parents themselves took hold of that meeting. And even when we are not calling them now, they were now pressing upon us to call and initiate a meeting. So that is how we did it. But I also believe that from the home visit, that also helped us, because we started with the home visit and they got to know that we care about them. And so when we decided to form that parent support group, it was easier for us to get their cooperation.
Thanks, that is wonderful indeed. We also have a parent support group here in Yaoundé, and it's been a wonderful time to bring these children and parents together. You see, Seth, Madam Obi, our own Ma Obi, I call her Ma Obi, she's saying, you have an excellent presentation. Great,
Thank
Seth.
you very much.
And that is a great initiative with the parents' home visit. It is indeed a moral boost to the family. Thank you for sharing. You see, Seth, I told you, what you just brought up today, I'm going to bring it in Cameroon, and it's such a wonderful initiative. We will call it a Seth home visit presentation.
Thank you very much.
We're going to work on that. I still have another 2 questions here for you. The question says, thank you for your presentation. What is the status and outlook of social service to patients with the orofacial cleft in Africa? I think
I've answered this question.
Yes, that's true. You've answered that question already. He said, please, my second question is yet to be answered. That is, second question is where these services are available. How have they been able to improve the care of these patients? I think that is a question he's talking about. So were you able to answer?
I think I've answered the question. The second question is about a question asked by Ifuluwa, and she's asking about, the person asking about, can social care be online based?
Yes.
Yes. Can social care be online based?
Exactly. That is the question. Then just take with the last question is from Herbert Fonte. I think I know Dr. Fonte. He said, how often and for how long are the home visits done? Okay. So can you take the 2 questions together?
Yes,
the online
please.
And for how long? How often and for how long are the home visits done?
Okay, so social care, for instance, if you are providing, let's say, counseling as part of the social care, that can be online based. But where you will have to teach the parents or the family some skills, or where you want to monitor how they are doing, you want to see the patient physically, it becomes difficult to do that online, especially in our setting where internet services is not very good everywhere, and some of our patients don't even have telephone for you to even call them on phone. And so we have a challenge in terms of providing social care online. How often and for how long are home visits done? So for us at CAF, what we were doing was that we were doing home visits on the last Friday of every month. So on the last Friday of every month, we will do the home visit. So before then, we have already designed our home visit plan, where we are going and the number of patients we are visiting, and we will call them maybe 2 weeks ahead that on this day will be coming. And so if the child will have to be in school, we would kindly plead that if they can let the child stay at home so that we can meet them. So that was how we were doing it. We were doing it the last Friday of every month. And for those patients who were within Kumasi, where our center is located, for them, we're doing it every other Wednesday. But for those outside Kumasi, we were doing it the last Friday of every month. That was how we were going about our home visit program.
Thank you. A very big thank you to the Ghana Cleft Foundation. You're really showing that you are the mother. And indeed, we are learning a lot from your experience. And Smile Train is teaching us that we are not just operating patients now, we are moving into quality care. And this is very important as far as social work is concerned. There is this comment from Dr. Ifelua. He says, thank you, Seth. I have learned a lot. Then Dr. Ifanyi says, a wonderful presentation, Seth. Home visiting really improves knowledge on patients' socio-demographic demographic or bonding. Patients' social demography and bonding. And Dr. Ngwe Anthony Neswa, hello Neswa, thank you for your great presentation. And Dr. Gyeka comes again. That's Prof. He said, great job, Seth. I think, Seth, you've done a wonderful presentation. I have some.
Thank you very much.
I want to ask you now, in this social work that you've presented today, it needs a lot of funding, because if you have to go out to meet these children, does your funding come uniquely from Smile Train, or you have some extra funding that brings in? Because I really love what you're doing, and I wish that every Cleft Center will do the same as you're doing. So where do you get your funding? Is it only from Smile Train, or can Smile Train answer this question? I know Nicole is there. Can someone answer this question alongside with you?
Okay, so for us at CATH, our support was coming from Ghana Cleft Foundation through the support of Smart Train for us to embark on our home care, sorry, our home visit. The hospital was also where, in instances where the Smart Train donated bus wasn't around, the hospital was kind enough to also give us some of its vehicles for us to embark on the home visits. But the majority of the support was coming from the Ghana Cleft Foundation.
Wow, that is wonderful. I wish that everyone would be get this message clear. Smile Train, does Smile Train have anything to say about this? Hello, Nicole. Hello, Obi. Can somebody answer on behalf of Smile Train on as far as supporting this initiative is concerned?
Hello, everyone. Yes, we finance this part of activity through Smile Grant. So to help our partners to reach the patients, and even we help through Smile Train. We fund hospitalization care and hospitalization fees and transportation of the patients. So yes, through Smile Grant. Yeah. Thank you.
Okay, I think all the members of the team, the CEOs and the surgeons and members of the Cleft team, you've heard it very clearly from Smile Train. Through your Smile Grant, you can be able to fund this, but it does not stop you from going an extra mile and funding the program with an extra funding. It's a very important thing to do. These people are not just articles; they are people with individuality and with we have to support them. You see, Seth, there is a comment here from Nicole. It's a wonderful presentation. Congratulations, Seth. And Dr. Adetokunbo of Adebola says, very impressive and educational presentation. Well done, Seth.
Thank you.
And Maobi says again, Maobi is saying, yes, Smile Train supports with the Smile Grant, just as Nicole has said. Well said. I want to say a very big thank you to you. You have done a wonderful job. I pray that Smile Train will be able to give us this material so that we can be able to improve on our cleft care. Thank you, all the delegates. Thank you for your participation today. Tomorrow is another day. I was sitting in for Professor Gwikwa, who was not available at the time. I want to say, Prof, thank you for giving me this opportunity to do this, even when you were present. And thank you, Maobi. Thank you, Nicole, for calling me up. And thank you to all the delegates. And we want to say Smile Train and West African College of Surgeons, you're doing a fantastic job. Tomorrow is another day. Encourage your team, encourage people to participate. We had a low participation of 37 persons today for a very important topic. Please encourage more people to join in this mission, in this telecleft teachings. It has helped me, it has improved my cleft care so much, and I want to say thank you so much. Kudos to you, Maobi.
Kudos, Dr. Oben. Thank you so much for such an insightful session. Seth, that was a very impactful session. We look forward to having you here tomorrow. We will be having a conversation about nutrition, same time, 11 a.m. +1 GMT for West Africa, and we look forward to the pleasure of your company. Have a fantastic day ahead.
Thank you.